Let us pray. Almighty God, who in your wisdom and goodness have appointed the offices of leaders and parliaments for the welfare of society and the just government of the people, we beseech you to behold with your abundant favor us, your servants, whom you've been pleased to call to the performance of important trusts in this republic. Let your blessings descend upon us here assembled, and grant that we treat and consider all matters that shall come under our deliberation in so just and a faithful a manner, as to promote your honor and glory, and to advance the peace, prosperity, and welfare of our country and of those whose interests you've committed to our charge. Amen. Next order.
Order number 1, administration of oaths.
Next order.
Order number 2, communication from the chair.
Honorable members, there is a communication. I recognize 64 students from Mount Olives Academy, Nakuru, East Sub-County, Medigai Ward, accompanied by their teachers, namely Mrs. Aurora Wanjiku, Ms. Rachel Mihari, Mr. Eric Mugambe, Mrs. Mary Mutua, Mr. Billy Agogo, Mr. James Simiu, Mrs. Hopeline Kemuma, Mr. Evans Kamau. In our tradition of recognizing and welcoming visitors, I take this opportunity to welcome you all to the County Assembly of Nakuru. Karibuni sana. Next order.
Order number 3, messages.
Next order.
Order number 4, petitions.
There is a report, that is a petition report by the Committee on Health Services that was requested by the Black Coffee Network and consortium of civil societies organizations in Nakuru County on operationalization of Rhonda Youth Friendly Centre. The Honorable Chairperson, Committee on Health Services.
Thank you, Mr. Speaker. Mr. Speaker, I rise to report on the petition that was sought by Black Coffee and a consortium of civil societies organization in Nakuru County on operationalization of Rhonda Youth Friendly Centre. Mr. Speaker, when we did receive that petition, as a committee, we felt it fit to go to Rhonda Health Centre, and we invited the consortium, that is the Black Coffee and other civil societies, and we went there, and we went together, also with the sub-county team, being led by the team lead of Nakuru West sub-county, and we really thought and we felt that it was good for us to sit there together with them. We held a meeting And in the meeting, we were taken through, all of us. Mr. Speaker, that is the background of what we did that day. And allow me, Mr. Speaker, to take the members through the said petition. Public petitions are provided under the Article 37 of the Constitution, as led together with Section 15 of the County Government Act, Cap 265, Laws of Kenya. The Nakuru County Light Petition Act and Standing Order 198 of the County Assembly of Nakuru Standing Orders. The petition was communicated in the House on Wednesday, 12 March 2025, and subsequently committed to the Committee on Health Services pursuant to Standing Order number 205, Part 1. The petitioners herein, Mrs. Angela Kioko, Mr. Martin Lunaro, Ms. Sophia Hishu, Mr. Michael Ojuang from Black Coffee Network and Consortium of Civil Societies Organization in Nakuru County, petitioned the County Assembly of Nakuru regarding operationalization of Rhonda Youth Friendly Centre. The petitioners' prayers were: the Health Committee should ensure that the Department of Health fulfills its constitutional mandate by operationalizing the Rhonda Youth Friendly Centre to increase youth-friendly services so as to address emerging issues of increasing new HIV infections among the youths and increased in mental health issues, gender-based violence, self-harm, suicide, and drug abuse. Number 2, the County Assembly Health Committee should ensure that the Facility Management Committee develops mechanisms to enable the participation of young people in the leadership structure of the facility. Number 3, develop a clear volunteer system and framework for young people from Rhonda and Kaptembwa to volunteer at the facility and incorporate the following opportunities: internship opportunities for young people at Rhonda Youth Friendly Centre, information on the mitigation of the triple threat, strengthen referral mechanisms for young people on the following: mental health services and the legal service system, team building and recreational activities at Rhonda Youth Friendly Centre, education at the facility level on the following topics: digital literacy, financial literacy, life skills, and sexual reproductive health and rights. Submission by the petitioners. The committee, upon receipt of the petition, invited the petitioners to ascertain the issue raised in the petition. In accordance with Article 37 of the Constitution of Kenya, 2010, the committee accorded the petitioners a fair hearing. Honorable Speaker, the petition, namely Lamran Josephat, Angela Wamaitha, Kioko, Michael Ojuang, Oliver Charo, Victor Mwikari, Hannah Maina, Chris Matangaro, Lillian Mwanza, Deborah Okumu, Kevin Mangi, Reverend Godfrey Adela appeared before the committee on 15th of April 2025. During the meeting, the petitioners informed the committee that they had held a meeting with the resident of Rhonda Health Centre and the officers within the health centre. From the meeting, it came out clearly that there was only one officer in charge of the health center who could not administratively manage the health center alongside the youth friendly center. The petitioner stated that the youth cited uncomfortability in accessing the health facility due to age gaps, where there is high teenage pregnancy reported in the area, and the teenagers are uncomfortable seeking services alongside their parents in the same facility. The petitioners further stated that the youth-friendly center is critical in sexual reproductive matters, nutritional as well as mental issues. They stated that engaging youths in recreation activities by engaging youths in recreational activities will assist in reducing and preventing youths in engaging in vices like drug abuse and HIV infections, amongst others. The petitioner stated that the major issue was the need for skilled and supportive staff, safe place for the youths, clear referral systems, and youth-friendly services. Mr. Speaker, as members of this House could go through the report attached there, they can see the pictorial evidence of the members when we visited Rhonda Health Centre. Submission by the CC Health Services. Upon receipt of the petition, the Committee on Health Services on 26 March 2025 wrote to the CCM Health Services requesting for a detailed report on plans the Department of Health Services has in place to ensure speedy operationalization of Rhonda Youth Friendly Centre. On 22nd April 2025, the committee received a response from CCM Health Services where she stated that Youth Friendly Centre at Rhonda Health Centre is operational and offers clinical services to the youth, including adolescent and youth sexual and reproductive health, into bracket AYSRH services. She stated that they have established a youth support group that conducts weekly radio talk shows. The only remaining thing is recreational services. The department is in contact with one of the development partners who is in the process of procuring and supplying the required recreational material for the center. Committee observations and findings. The committee, after consideration of submissions before it and having visited the Youth Friendly Centre, observed the following. Number one, that the Rhonda Youth Friendly Centre lacks clear and proper frameworks, guidelines and program for it to be fully operational. Number two, that the Youth Friendly Centre had been allocated a total of 10 million for construction and equipment for 3 consecutive financial years as follows. Kenya shillings 5 million in the financial year 2017-2018 for construction. Kenya shillings 3 million in the financial year 2019-2020 for completion and equipment. Kenya shillings 2 million in the financial year 2020-2021 for completion. Number 3, that the Youth Friendly Centre is fully equipped but not operational due to lack of staff. Number 4, that the Youth Friendly Centre is not people living with disabilities friendly because the building lacks a ramp. Committee recommendation. Based on the above observations and findings, the committee made the following recommendations. That the county government of Nakuru, through the Department of Health Services, should come up with clear and proper guidelines, framework, and a program for operationalization of Youth Friendly Centre. Mr. Speaker, this is not only for Rhonda Health Centre, but any other Youth Friendly Centre that we have. And I'm happy to report that we visited Gilgil Sub-County Hospital and we found one of the active and a very progressed program-based Youth Friendly Centre at Gilgil Sub-County, and we encouraged all the facilities to follow the same. Mr. Speaker, this is in line with the act that we have here, one of our laws, that is Maternal Health, Child and Adolescent Act that we passed in this House, that requires that each and every facility, including a dispensary, should have a youth-friendly center. Number 2, that the Department of Health Services should ensure operationalization of the youth-friendly center in a month's time from the date of adoption of this report. Mr. Speaker, I can confirm that though belatedly that we've passed this report, or rather we are responding to this report, I can confirm that there is some operations that are currently being carried down, or rather there is some activities that are happening onto that youth-friendly center, and we will request that because they agreed that they are going to operationalize it gradually to make sure that it fully operates, that the Department of the Health Services, in collaboration with the County Public Service Board, should consider hiring 1 clinical officer, 1 nurse, and 1 counsellor for running the youth-friendly center. Mr. Speaker, just recently they concluded recruitment of nurses, clinical officers, and medical officers, and therefore we are expecting that they will be posting some officers there, so that at least when we be going back to confirm, or rather when the implementation committee will be going back to follow up on this petition, they are going to find that youth-friendly center operational, so that the youths of that area can find some place actually to go and relieve themselves, and whereby they can be getting some therapies. Mr. Speaker, also, I remember that we had passed a law requiring internship programs to be conducted by the county government of Nakuru, and therefore we expect some of the youth who are through with their academic through the campuses or the colleges, they can be posted there also to assist the said facility, and so that the youth can get the proper services that they deserve. Number 4, that the hospital management through the Department of Health Services should consider putting up a ramp at the Youth Friendly Centre to cater for PWDs. Mr. Speaker, people able differently, and we had one of them there during our facility visit, and they complained that because now all the Youth Friendly Centre activities are on the first floor, them themselves cannot be able to access the said services, and therefore they requested that the alarm to be put into place, so that they can also be able to be accessing the said facility for services. And therefore I would wish also to challenge the area member to consider putting some funds aside to do the said works together with the department. They can partner together with the department to making sure that at least there is a lamp in that facility. Number 5, that the Department of Health Services together with the County Public Service Board should consider recruiting and operationalizing the internship program at the Rhonda Youth Friendly Centre. Mr. Speaker, as I said earlier, we have a law that requires the departments to make sure that we have people who are actually recruited under internship, so that at least they can be able to facilitate or rather to bridge the gaps in terms of human resource that is required at a cheaper cost. Therefore, Mr. Speaker, that is also a recommendation of the members of the committee. And also, Mr. Speaker, we felt good actually to say the recreation facility, the youth-friendly center are not recreational facilities. And the recreational facilities are in the Department of Social Services and also the youth, and therefore that they should consider actually providing amenities that the youth should go and actually relieve themselves. They should also come up with the programs like athletics activities in the morning, Mr. Speaker. That is the prerogative of the Department of the Youth and Social Services. But however, the medicals, or rather the health department, should narrow itself directly towards making sure that the well-being of these people is catered for. Therefore, Mr. Speaker, I beg to submit that was the report from the Health Committee, and we agreed with this consortium because we sat down with them, both here at the chambers, and also we went onto the ground together with them, and they agreed with us. And therefore, Mr. Speaker, I beg to submit and to report back to the House and to the petitioners as we agreed together with them. Thank you, Mr. Speaker. I beg to wait.
Thank you, the Chair, Committee on Health Services. I will allow 2 members to comment on the report. The Honourable Minority Leader.
So, thank you, Mr. Speaker. Mr. Speaker, listening to the Chair for Health talk about the Rhonda Health Centre or the Friendly Centre, there is this group that came up with a petition. They're calling themselves the Black Coffee Network. Mr. Speaker, I would have wanted to hear from the Chair the background of these people, because the minute they mentioned black coffee and the facility, Mr. Speaker, these things are not matching. Therefore, the Chair should have told us, or should have gone further to clarify who are these Black Coffee Network and what is the relationship between the coffee and the facility at the Health Friendly Centre. Mr. Speaker, too, we'd also want to hear from the Chair, because they visited the facility, what is currently available, which makes it a youth-friendly centre, vis-a-vis what is not available, so that, Mr. Speaker, we can come up with a conclusion and say that the Rhonda Friendly Centre is either friendly or unfriendly. Mr. Speaker, those are the remarks. But however, because a member of that area, the Honourable Mashari, is also here, he can also give us a background of that centre, what is happening, and if it is true, what these black coffee people are saying about is actually true about the centre. Thank you, Mr. Speaker.
The Chairperson, Committee on Health Services, you can respond to the issues raised by the Honourable Leader of Minority Party.
Thank you, Mr. Speaker. Mr. Speaker, allow me to disabuse the notion that that this facility is in Londa Ward. Mr. Speaker, this facility is in Kaptembwa Ward. It is not in Londa Ward. It's only that it's the neighboring the Londa Ward, and they share the names, and that's why even the member is wondering why it's being mentioned. But Mr. Speaker, this is in Kaptembwa Ward. And Mr. Speaker, allow me also to disabuse the notion that this is black coffee. It is meant for people who sit down and take coffee, or rather they are advocating for black coffee. Mr. Speaker, this is just a name. But however, Mr. Speaker, in the lapis, there is something we call anonymous. There are people who sit down actually to drink coffee, and in a therapeutic manner, they talk about the issues that are affecting them. So, and when these people are sitting down, is an organization of youth, individuals who are youthful in the civil societies. They thought of coming together in a manner whereby they could have sat just for a coffee to discuss matters, but they thought of coming up with this name. Themselves, they don't advocate for coffee, but it's an anonymous group that actually came together and listened to the issues of the youths. And they felt that Kaptembo is one of the areas that had been affected greatly by the issues of the teenage pregnancies, suicide issues, and also the rampant increase on the issues of the HIV infections. And that's why they call it the triple threats. Mr. Speaker, allow me to say that when we visited the facility, I just paraphrased the report because of time. Mr. Speaker, when we went to the facility, we found that there is a structure, one story building that was constructed, as I said, with 10 million, and a building that has have a room. It has some sites for clinical services and the rest of the services, Mr. Speaker, for a facility. It also had a conference hall whereby actually it had tables, it had TVs where even the members of the public or rather the youths can be able to enjoy. But however, in the recreational side, where they were supposed to have had a pool table, whereby even the users, the way to be attended, they can receive some recreational activities, was missing. And that's what the department was saying. There was a developer or a partner who wanted actually to supply the pool tables so that these youths can be able actually to receive those recreational services at that point. However, Mr. Speaker, the only thing that was lacking in that facilities was the issues of staffs. And that the critical area that even these petitioners had sought actually the relief or rather the assistance from this assembly is to make sure that there are staffs who are posted in that facility to make it operational. Because they were saying there was no value for the money for 10 million shillings just to go down, and from 2020 up to now, from 2018 up to now, and there is nothing that is happening. Mr. Speaker, allow me to say this is one of the facilities that we've been saying we have constructed a lot, but we are doing nothing. Mr. Speaker, sometimes I say, for one to be cured, we don't need buildings. Our forefathers used to sit under the tree, and they could be attended to. So the critical thing here, Mr. Speaker, is human resource aspect of it. And Mr. Speaker, I had mentioned that now that there was a recently recruitment that was concluded, and the staffs received their letters, we are expecting that Londa Dispensary, or rather Londa Health Centre, has some posting directly going to this Youth Friendly Centre, so that at least members of the public, or rather the youths, can find a place where they can get services. Mr. Speaker, I would wish also the members to note that Londa is within, yes, though formal, but in one of the slum area that has a huge number of youths. And remember, Mr. Speaker, the way you are seeing even the youth reacting currently, and they have, they have codified themselves to be Gen Zs, there is something that is happening. Then there is some pressure that they are receiving from maybe the change of the economic challenges and the rest, Mr. Speaker. And therefore, that's why we are saying, Mr. Speaker, it will be prudent for the department to prioritize employing staffs who will be dedicated to that youth friendly center, and it can be a youth friendly center of referral in Nakuru East and West, Mr. Speaker, because it is somewhere where it can be able, it's accessible, and the members of the public can be able to be going there for youth friendly services at that level, Mr. Speaker. Therefore, Mr. Speaker, allow me to say the only thing that is lacking, it is human resource. With human resource, we are good to go, and I expect that this report, Mr. Speaker, will be submitted to the executive with urgency. And we'll be going back there, Mr. Speaker, in the month of December to confirm whether it is operational and whether they are attending to the youths. And we are going to even to see the number of youths that have been attended so that we see whether our money have value or not. Therefore, Mr. Speaker, allow me to respond to Leader of Minority and tell him that the only thing that is lacking there, it's only human resource aspect. The building are very good. And Mr. Speaker, the area member, today I'm not seeing him, but he have done a tremendous job and to construct such a kind of facility. I have never seen another youth-friendly center of such nature. Thank you, Mr. Speaker.
Thank you. The Honorable Chairperson, Committee on Health Services. There is a member from Nakuru West where the facility is situated. Now that the Honorable Kajuang is attending some other functions and some other duties, there is a neighbor, the Honorable Member for Rhoda Ward. What can you comment about the report?
Thank you, Mr. Speaker, for this opportunity. I'm John Masharia, representing the people of Rhonda. It is mentioned Rhonda, but Mr. Speaker is not in Rhonda Ward, but is in Kaptemba Ward. But nevertheless, first of all, I want to welcome the children from Mount Olive and to congratulate them for coming here in the assembly to see how we do our plenary. And also, in a special way, I want to acknowledge Rahab Wairimo and Chichi, who are the students in that school. We are related. So I want to acknowledge that, Mr. Speaker. Also, Mr. Speaker, I want to echo and to support this petition, because in Rhonda, there are so many youths, as the chair has said, that they need to be captured, they need to be taken care of. We also have a polytechnic that is going on. And I think the departments that are so concerned in the things of the youth, they need to rise up to the standard this time, Mr. Speaker. Because if we won't do that, we will continue losing our youths, we will continue having our youths will start entering into groups that are dangerous, like Confirm and other groups, that we will not be able to reach them. But if we capture them through these programs, through internship, we will be able to help them. So I support this petition, and I congratulate the Committee of Health. Thank you, Mr. Speaker.
Thank you. Next order.
Order number 5, papers.
There is a paper by the Chairperson, Committee on Health Services.
Mr. Speaker, I rise to table a report on health services on the visit to Mukorombosi Health Centre held on 27th February 2025. I beg to lay the paper.
Thank you. The paper is properly laid. Next order.
Order number 6, notices of motion.
There is a notice of motion by the Honorable Njuguna Mwaura, Chairperson, Committee on Health Services.
Mr. Speaker, I rise to give a notice of motion that this House adopts the report on the Committee on Health Services on the visit to Mukorombosi Health Centre held on 27 February 2025. I beg to give the notice of motion.
Thank you, the Honourable Chairperson. The notice is properly given. Next order.
Order number 7, statements.
There are no statements. Next order.
Order number 8, motion.
There is no motion. Next order.
Mr. Speaker, sir, those are the orders of the morning sitting.
We all rise. Honorable members, this House is adjourned to today, 2:30 p.m. Thank you.